Hello and welcome. My name is Dr. Nelson Lee Novick. I am an emeritus clinical professor of dermatology at the Mount Sinai School of Medicine in New York City, and I have a private practice devoted to cosmetic dermatology located on Manhattan's Upper East Side. This video is part 2 of a 2-part series devoted to non-surgical injection facelifts. In the previous video, we covered the use of neuromodulators such as Botox for quieting down the overactivity of the muscles in the skin that underneath the skin that are responsible for etching and creasing of the skin with the passage of time. In this video, I'm going to cover the enormous contribution to the loss of volume that comes from the tissues beneath the skin and their contribution to what we see in the aging face. We have numerous structures underneath the skin that hold up the fabric of the skin. That includes fat and muscle and bone and fibrous tissue. But I just want to concentrate in this segment on just the contribution of fat, to the underlying fat, to supporting the skin and giving the youthful appearance. We have numerous fat pads through the skin. Let's just look at one fat pad. This is the fat pad located between the eye that sweeps out from this corner to all the way the inner corner of the eye and down the cheek. And if we look, this is the more youthful face. And this is the face that corresponds to it. No lines, no wrinkles, no jowls. Now, with age, another 15 or 20 years later, in the 40s or so, the fat pad shrinks and shrivels. And now that it's shrunken and it's shriveled, gravity can get a hold of it and pull it down the way we see here, downward and inward, to create the marionette line, the smile lines, the marionette lines around the sides of the mouth. It can leave the descent can leave the under eyes free of much fat, and so they begin to show tear troughs and hollows and sags and bagging. And furthermore, there's a direct pressure from that descent of the fat along the jawline to cause the jowls along the jawline. Compare the youthful face, where the fat is in the proper position, to the aging face, where the fat has caused all these changes. So if loss of volume is responsible for so many of these changes, very simply, the restoration of volume with the use of appropriate HA fillers for contouring the skin, for providing volume, for providing lift. If we're placed in the appropriate areas, this revolumization with fillers can accomplish certain things, such as if in the temple area, if you resupply the volume, you can also get the fox eye lift to the eyebrow for the outer third to be upward and outward appearing is in the youthful feminine face. Restoration of volume in the cheek can not only lift the cheek and create the OG curve, that oval heart-shaped desirable feminine face, but it can also diminish secondarily the smile lines and improve the under eye hollows. And if you use a contouring HA filler along the jawline, you can straighten and define the jawline and diminish even underneath submental drag. Low viscosity, malleable, cohesive HA fillers can be used to elevate and smooth residual horizontal furrow lines. It can complement the use of Botox in that area, or it can be used in the area of the crow's feet to also complement the effects of Botox. You have one thing, the Botox, working against the motion that leads to the creasing and etching, and now you have these low viscosity HA fillers that can elevate and smooth the lines that had already formed. HA skin boosters can be used for the crinkles and parallel laugh lines at the lower portion of the face by increasing hydration to the skin and tautness to the skin. And all of the aforementioned treatments can be done, if so desired, in one treatment session, which engenders very, very little post-treatment downtime. For more information on this or any other subject, please check out my website, youngerlookingwithoutsurgery.com, or drnovick.com. That's DOCTORNOVICK.com. Thank you for your attention.